Welcome back. For this section of the day, we will be bringing together unique perspectives around the impacts of racism on adolescent health. We'll begin with a video prepared by youth to share their experiences, transition to a panel style conversation with two adolescent health professionals, and finally close with an opportunity for Q&A. If you have questions for the speakers, please enter them in the chat throughout the presentation. We're also noticing quite a few resources dropped into the chat. Feel free to add those to the collaborative Google Sheet as well, so that you all can share the resources in real time. So I'd first like to introduce the youth that prepared the video for today's audience. The video features Saida Abshir, Jessica Taylor, and Ashanti Campbell. Saida Abshir is a sophomore at the University of Michigan, majoring in biology, health and society, and Afro-American and African studies. They plan to pursue a career in medicine and are currently interested in reproductive and maternal health care. Saida is passionate about solving racial and ethnic disparities within health and medicine. AHI's Teen Advisory Council, TAC, provides a space for her to voice her passions concerning these structural issues and the resources and methods to combat them. She hopes to help TAC push for effective structural changes, as she believes that all people deserve equal access and treatment within healthcare. Lastly, Saida loves to cook, is a henna artist, and is the oldest of 6. Ashanti Campbell uses he, him, his pronouns. He is a writer with staying power in Ypsilanti, Michigan. He is a Muslim man who was born in Dearborn, Michigan, and moved to Ann Arbor when he was 8 years old. He then moved to Ypsilanti when he was 12 years old. Today, at 20 years old, he is an actor, singer, and music creator. He has a 4-year-old dog named Ace that he loves. Jessica Taylor is the senior broadcast journalism major at Wayne State University. Jessica dedicates her time to helping improve the lives of Black students at Wayne State University. She serves as the College of Fine Performing and Communication Arts Student Senate representative for her university. There, she spearheads the Black Student Success Working Group, committed to improving the experience of Black students across campus. As former vice president of the Black Student Union, WSU chapter, Jessica is familiar with being in leadership among the African American community. When she's not in class or helping a friend, you can often see Jessica hosting events as Chief Engagement Coordinator for the Journalism Institute for Media Diversity. She also engages with students and residential life as a resident advisor in Anthony Wayne Drive Apartments and as social media manager of Temple Campus Ministries. Outside of her professional and academic commitments, she enjoys attending music festivals and spending time with family.
Hi everyone, my name is Saida Abshir and I'm a TAC member. My pronouns are they, she. I'm a sophomore at the University of Michigan studying biology, health and society, and Afro-American and African studies. I'm currently sitting in front of a light purple or a lilac colored wall. I'm a 19-year-old Black Somali Muslim woman and I am observing hijab. I'm wearing a black headscarf and just a plain black shirt. I have brown skin and I have black or brown colored eyes. And I hope that this can help create a visual for everyone. I'm very excited to be speaking to you all today. My positionality within this work is I'm very passionate about improving patient care for all people. I joined TAC because I want to understand and learn how to combat issues within adolescents healthcare. As a young person, I believe that I can help create that change by providing my experiences. I have multiple intersecting identities that allow me to provide perspectives that might not get shared as often as they should. Additionally, I'm interested in a career in medicine, and as someone who hopes to one day take care of adolescents, I want to be able to provide the best care to patients regardless of their identity. And I believe that the sooner that I can start learning how to do that, the better. I've had the chance to work in settings like hospital or research within medicine that help me understand why it's so important to take health disparities serious, especially within adolescents healthcare. I've seen people have their lives at risk simply because of something like the color of their skin or a belief that they might hold. To me, racial justice within health means people of all identities receive equal treatment, equal access to the healthcare that they need. I believe that health disparities exist not because people of certain racial groups or ethnic groups are different biologically to others, but because structural racism is embedded into our medical system today, which affects how certain racial and ethnic groups are treated in health and medicine. I belong to and serve multiple different communities, including the Black community, the Muslim community, the immigrant community, the African community, and a few others. When we talk about adolescents' health amongst these communities, I think it's important to take an intersectional approach. Not only do the youth in these communities experience issues within adolescents' health, they also experience what it's like to be Black, Muslim, queer, and many other identities within these spaces. This creates an entirely different experience. When you take an intersectional approach, you're acknowledging that these individuals have multiple oppressions that are not suffered separately, but rather as a single synthesized experience. This variety of identities are not catered for by our medical system today, which doesn't allow these individuals the access that they deserve to have equal treatment within healthcare. Through initiatives like TAC and this conference today, I believe that we are getting closer to creating structural change, which is meaningful change within our medical systems. Thank you so much for listening.
Hi, I'm Jessica Taylor. I'm an African American woman with a high curly ponytail. I'm wearing a navy blue blouse and gold earrings today. To address the topic of today's panel, I'll give a brief background about myself and how I relate to adolescent health. I'm a 21-year-old woman, and as of my 18th birthday, I have been in search for the perfect primary healthcare physician. My first visit to the gynecologist was very uncomfortable. I saw the same doctor that my mother has seen throughout her entire adult life. He's an elderly white man, and during the visit with him, I felt really unseen and unimportant. There was no explanation of the tests and checkups compared to my experiences I've had with my pediatric doctor. He spoke to me in a very condescending and dry way, and I felt out of place the entire time. During the discussion portion of the visit, he attempted to highlight the importance of contraception by saying people like me were likely to get pregnant, so I had to be careful. After discussing the visit with my mother, she confirmed that that was the personality of the doctor. She never felt like looking for someone else and decided to deal with it. I decided that I wanted more from my healthcare physician, and I began searching for that. Once the pandemic hit and in-person visits came to a halt, I did my search. I wasn't until a point where I was having to go back to my former pediatrician, in which I understood the importance of having a medical healthcare physician that you trust. I say this to explain my relationship with adolescent health. It's the journey that I'm on right now. I'm still seeking for a PCP who makes me feel seen and makes me feel comfortable. I'll walk you through some professional and academic experiences connected to racial justice as well. I play a very active role in my community here at Wayne. One of the most educating and enriching experiences I've had is serving as the vice president of the Black Student Union. Here, I connected with hundreds of students about their unique Black experience. Once we held a forum dedicated to Black mental health. If the consensus of the conversation, it ultimately came up to that Black students felt as if their mental health was not a priority, and their educators and their health professionals did not prioritize them at all. My peers, especially Black women, dealt with the repeated cycle of having their anxiety or trauma being misinterpreted as having a bad attitude or being standoffish. They express feelings of loneliness due to their mental health professionals not knowing how to address these issues. In addition to ties to racial justice and representation, I'm also an African American Studies minor. I'm currently taking a course in African American psychology, which focuses on the contemporary theories and research that describe and explain the social and psychological experiences of African Americans. A recurring theme is the advancement of Black psychology, or as I will refer to it as, understanding the Black experience. This was hindered when scientists, researchers, and doctors viewed life only from a Eurocentric view, rather than from the standpoint of the people that they were trying to assist. The same logic as in conversations with professionals and peers who feel unseen by their medical professionals. The patients feel that they cannot relate to people who are providing proper care for them. On the conversation of developing anti-racist practices, we have to understand that the identity, culture, experiences of that race before you can tackle your approach in aiding them. The impacts of racism and failing to understand the identity of race are damaging by closing the door for real opportunity and change to come. The peers who felt unseen by their PCP or therapists didn't address these issues or search for new care. They decided to stop seeking medical care altogether. Deciding not to seek care is a popular trend that I see in my community. When trust breaks between a minority and the medical field, it's extremely hard to repair that trust. Additionally, racism doesn't allow the patient to receive adequate care. Racism is bias, and you can't effectively help someone to be genuine when your biases are controlling the perspective of how you would direct that care. I hope my anecdotes help emphasize that anti-racist care starts with understanding race and a desire to make your patients feel seen, heard, and comfortable. Thank you.
Hi, my name is Ashanti Campbell. I use he, him, his pronouns. I am a 20-year-old African-American young man. I'm wearing a striped button-up shirt. Behind me is this white wall with wooden panels, this little heater here, and these shelves up here. I'm with Staying Power, and what Staying Power is, it's a group here in Ypsilanti, Michigan. We actually originated in Richmond, California, but in the last few years, we have created this cohort here. And what we do is we combat gentrification and housing insecurity through the arts, and we center youth voices in order to do this. And it's actually a youth ran organization. And if you aren't aware what gentrification is, it's the process of moving people who live in lower income housing, moving them out through process of rent inflation, utility inflation, things like that, in order to raise property value. And often enough, people of color and minorities are affected negatively by this process because often enough, minorities and people of color are living in these areas and situations. So we like I said, we center youth voices so we can make people aware of these struggles, as well as change the community that we live in. I think I wanted to leave you guys with a small piece that I wrote a few years back for Poetry Night in Ann Arbor, and then I'll say a quick goodbye, and I hope you guys have a wonderful day. It's a working title. Being a young black man in Ann Arbor, you expect me to talk about how being a young black man in Ann Arbor makes me feel. You expect me to talk about how much it sucks, because it does, although my father taught me not to use I feel statements, taught me to replace them with I think. Yet feeling is a part of poetry, and poetry is what I do, so I decided to morph the two in this piece that I bring to you. I sit down in a classroom full of people I see every day. To the left of me, my best friend for 3 years. To the right, a girl with a smile that mimics a shield, meant to keep away the real questions like, how was your day? Or even worse, awkward silence, so she sends weaponized words through the cracks of her pearly whites, just like everyone else in the room. All of them fighting. Fighting even though they don't know they were fighting. But for some reason, they keep fighting to the point where their smiles mimic pain. Everyone's smiling. But I'm not smiling, so something must be wrong. My friend asks me what's wrong. I say, I'm the only black person here. Usually I see this as a sign of individuality, which I love. a badge specifically made for me, I should be happy. Oh, if I could shake the hand of whoever made this happen, I would give them a hug. To be proud of the skin I cannot rub off. That's what I was taught. But this time, the air felt thick. My heart felt a little heavy. And the small room packed with 34 students felt empty. Sometimes individuality is a bit lonely. Thank you guys for listening. I hope you guys have a wonderful day.
Thank you so much, Saida, Jessica, and Ashanti, for sharing your experiences with us and how your various identities show up in the healthcare that you receive. Now I'd like to introduce two panelists who will be answering questions on the health impacts of racial inequities in adolescent healthcare for youth with intersecting marginalized identities. Our first panelist is Teresa Springer. Teresa Springer is the Director of Programs at Wellness Aid Services in downtown Flint, Michigan. Teresa is of House Springer, first of her name, writer of grants, manager of programs, shaker of systems, rejecter of racist, homophobic, transphobic regimes, denouncer of discrimination, professional side-eyer of shady people, and lover of equitable solutions. Our second panelist is Dr. Chulani. Dr. Chulani is a queer multicultural immigrant clinician, author, educator, and advocate. He serves as section chief of adolescent medicine at Phoenix Children's Hospital and medical director of Phoenix Children's Gender Support Services. He is also associate professor of pediatrics in the Department of Child Health, University of Arizona College of Medicine, Phoenix. He completed his pediatric residency training at Maimonides Medical Center in Brooklyn, New York, his fellowship in adolescent medicine at Children's Hospital, Los Angeles, and his master's in education from the University of Southern California Keck School of Medicine. His primary areas of interest include adolescent sexual and reproductive health, the care of gay, lesbian, bisexual, transgender, and questioning youth, health equity promotion, and diversity and inclusion. He is a member of the Society for Adolescent Health and Medicine's Diversity Committee and served as co-author for the organization's positions promoting equity and reducing health disparities among racially, ethnically diverse adolescents and racism and its harmful effects on non-dominant racial ethnic youth and youth-serving providers, a call to action for organizational change. He has delivered lectures and workshops nationally and internationally and is the recipient of numerous awards recognizing his contribution to adolescent health. He has led and participated in numerous local, state, and national curriculum development, program development, and quality improvement initiatives to promote adolescent-centered care. So we thank you both for being here. We're so excited to be in community with you. So can you begin by sharing your positionality in this work?
Sure, if I might go first. First of all, good afternoon, and it's a pleasure to be here. I am Dr. Vini Chilani. I am a cisgender, queer, brown, able-bodied, small-bodied immigrant settler. And as a settler, I acknowledge that I have benefited and profited from living in this land that really is a result of the subjugation and displacement of our indigenous people, and I acknowledge that. I also carry with me the privilege that comes from my education, my profession, and from my social standing. And my background really as a clinician is in working with adolescents and young people, and I bring to this group 2 decades of clinical work and working with young people, but also, you know, when I think of levels of, just as there are levels of racism, there are levels of anti-racism, the micro, the meso, and the macro. And I have been working in the macro space as a clinician caring for young people and promoting youth resilience and youth development. And my meso and macro work really is about the authorship and participation in initiatives that advance anti-racist approaches.
Thank you, Dr. Chulani. Teresa?
Lauren, you want me to kind of like do what Dr. Chulani did?
Absolutely, absolutely. Yep. Can you begin by sharing your positionality in this work?
Yeah. So it's kind of hard because I think it kind of originated with my family. So I'm biracial, and my mom was a white woman. And when she got pregnant with my older brother, she got pregnant by a Black man, and a man of color, and she was ostracized from the family. So there was a side of the family that I never met at all. Like, so I never met my grandma, I never met my granddad. I met my aunt once, and we had spent the night over her house, and me and my cousin got into it. And my auntie told my mom to get her little N-word daughter. And like, that was like the last time we went over my aunt's house. And so like race was always kind of like a theme in our house because we were the mixed family. And I grew up in Black neighborhoods. I was like, my mom was not raised by Black women, but when my mom was put out her family, Black women took her in. And when I say they loved on her, that is an understatement. They loved on her. And so we grew up in a Black neighborhood. We grew up impoverished. I grew up on the south side of Flint, in the terrace, or African East Apartments. We called it the terrace. And so it was always a theme in our home. And so when I was in school, I was lucky to have mostly Black teachers. Like, a lot of people are just like, oh, I didn't have a Black teacher until this age. Like, I had a Black teacher in kindergarten, pre-K. Always had Black teachers. And so Miss Woods, she started teaching us about slavery and just like white supremacy. And it just always kind of like stuck with me. And it stuck with me like to this day. Like it stayed with me that there's this big disparity based on the color of your skin. And then, of course, like colorism in the Black community, so on and so forth. And so when I did my internship here at Wellness, I started working closely with LGBTQ plus people. I got a lot of LGBTQ plus family. My mom was very like open and honest. And like, I remember me being like, what are them two guys doing holding hands? And she was like, oh, honey, some men like men, some women like women. That's just how it go. And I'm like, oh, okay, all right, bye. And so when people be like, I can't describe it to my kids, I'm like, yes, you can. Simple. And so when I started here working in HIV and sexual health, like I saw the disparities, and I saw how, like, when I linked people to care and treatment, how they were treated at those places, and how they come back and be like, man, Teresa, like they did everything but call me the N-word there. And I'm like, straight the fuck up. I mean, straight up, my bad. I'm sorry about that. But like, and so it just really gave me a passion for like this work. And so I started doing like trans workshops and different things like that, because there was no one here in the city to do it. And then I was just like, okay, yeah, this is not my wheelhouse. Like, I'm an ally. I don't identify. I need to like step out of this and step into my wheelhouse. And my wheelhouse became decentering whiteness and in social service and medical providers, like just decentering whiteness, not centering Blackness at all, but centering your client or your patient at that time. Like, that person needs to be centered. And so I come from this framework of all of our systems are built on this white supremacist like framework, like this foundation, and we got to destroy the foundation and build another one. And I'm just trying my best to contribute to that in the most meaningful way possible, while not overworking myself or overburdening myself in a way that burns me out where I can't do this work anymore. Like, and so I try to do it in a very healthy way, but in a very call you in and call you out way. And so now I'm the person that when a client got an issue, I'm definitely calling and being like, so, and then offering a workshop or two. But yeah, so that's, yeah.
Thank you. And I think you both touched on this a little bit, but what do you do and how is your work connected to racial equity or justice?
Good, should I go first? So again, when I think of the levels, right? So what do? I am a clinician. And in the last 2 decades, I've really been working largely with youth of color and marginalized communities. So the part of my background that I didn't share was that I was born in the Philippines and I was raised there. And in our colonized world, we looked up to America and we looked up to whiteness and we all wanted to be Americans. And America was prosperity and opportunity and youth culture and Porky's and MTV. And at the end of my training in the Philippines, I came to the US, and that was the first time when I moved to Brooklyn, working in inner city Bed-Stuy, seeing the ravages and the failure to thrive that many of our young people were experiencing. And we saw their social ills from HIV and unintended pregnancies, and we made them out to be poster children for everything that was bad about young people, when we really didn't think about how we as adults have a responsibility to create the best spaces for our young people to thrive. We are accountable. And so in my work with young people, I've worked with inner city youth in Brooklyn and Los Angeles. And in my current role, I work with a large contingent of LGBTQ+ identified youth of color, and really providing affirming services. And in my clinical work, I try to translate what we know fosters youth development and positive outcomes for young people. That includes fostering a positive sense of self-concept, be you as a racial, who you are racially, who you are sexually, who you are as a person, and how you promote self-care and encourage self-care and make sure that they have access to health services, how you foster supports with families, with communities, with peers and pro-social resources, and also how you promote youth empowerment and engagement and activism so they can be part of transformation and change in ways that are youth-centered. And so that's the nature of my micro work with young people. At the meso and sort of macro level, I've been involved in scholarly work around how do you approach LGBTQ+ young people? How do you create clinical spaces to find out about youth, who they are, what portions of their identity they hold as defining? What are your experiences? How are you coping? How can we help you cope better? And how can we help you because liberation proceeds from the inside out, right? How do we help you as a young person thrive and be resilient, but also prepare you to step out to be able to impact larger structures and systems? And so I've had the opportunity for, in March of 2019 to work with the My Voice project, where we asked youth, tell us about your experiences of racism, what it's like, what do you think are solutions? And it's been just an opportunity to amplify youth voices as we begin to transform micro, the meso and the macro. And I really emphasize that, as an immigrant who has profited from being here, holding up a mirror for us to see who we are, that we in America, we do not distribute opportunity equally, is not disloyalty and lack of gratefulness. This is our civic duty. And hopefully, as we begin to really recognize who we are and how we fail a segment of our population because of the color of their skin, what hurts one of us hurts all of us. And racism is a corrosive force, and anti-racism is a verb. And so in my meso and macro work, it's about how we engage in active anti-racism at all levels.
That was beautifully said. I started my work here at Wellness back in 2005. And I started, I worked in the jail, in the county jail, with commercial sex workers, Black and brown, that I worked with commercial sex workers to basically teach them how to negotiate safer sex. And so it was less about working with them to stop sex work and more working with them to negotiate safer sex. And from there, I started working with LGBTQ plus youth, specifically gay Black men, on negotiating safer sex, reducing their risk of HIV, because it's interesting because I had a really close friend in high school, and he never came out until later on. And when he came out, like, we ran in those same circles and we knew the same people. And so when I started here at Wellness, reaching Black gay men was a struggle here. And it was really hard to do, especially young Black gay men. And when I started my internship here, I was just like, oh, well, I know a lot of people. And so what we did was we started doing these dinners. And at these dinners, we would have somebody host the dinner. We would do education series at the dinner. And after the education series, we would test. And these were all young gay Black men, ages like 13 to 24. I usually didn't have many people over 24 in those sessions. And so it really connected me with more youth and the disparities that gay Black youth experience in healthcare and social service fields. And then that connected me to trans youth and how they were ostracized in their systems. And so we started creating what we call access points for individuals, because in the city of Flint, it's almost like it's almost like it's not okay to be anything here. And any identity, unless it's a white male identity, is shamed. And so we start creating these access points along with one of my colleagues, the one I'm talking about from high school, who had recently passed. So we created, it's called Our Safe Space Ally Center. And it was a space that individuals could come. And we thought it would just be like this hangout space where individuals would come and just like, it'd be a safe space to just be yourself. And it turned into almost like a resource center where we spent a lot of time linking and discovering all the linkages that we didn't have in the city. And so there was a lot of times that we had to like travel, like help people get down to Ann Arbor and Detroit for medical care. It was a lot of times that we had to help navigate school systems with bullying and things like that. And then interpersonal conflict with family members that don't agree or disagreed with identities and would use housing as a method to get them in line. And then it moved on to, like right now, what we were doing was every time that we engaged with somebody, we were trying to get them into testing and we were trying to get them these other services, but like it stopped being fun. And with that, it's just like, it shouldn't always be kind of like this doom and gloom aspect, like, oh, come here and this. And so we were missing that fun factor. And so we started organizing the annual Gay Pride event here in Flint. And it was another access point for individuals to come get linked to all these services. The vendors were always always screened for LGBTQ plus friendliness. Like, so like if you, not even friendliness, like knowledgeable, like, so if you put in a vendor application for Flint Pride, you're not gonna get approved just because you paid a vendor fee. It's just like, are you doing this because you like, this is an audience that you want to like reach, or are you doing this because you want money from them? And so we were very good at like screening that out. And so like it became like this little hub, like where you can come, you can access resources, you can get tested, you can like get food, and you can like have fun. And so it just like, it was always like in the back of my mind, like linkages are important, but fun is important too. And not having to exist in your, not having to exist as a minority, like as, I don't know how to put it exactly what I want to say, but not having to exist in your trauma 24/7. We were trying to like create moments of joy for people. And with that, you know, expand into linkages to care and treatment and things like that. And the medical care, we've developed resource guides to get people linked to care. We have like a little small speakers network to where like, if like right now we're doing the Trans Day of Remembrance. And like, so it's like, one, we can get you some trans speakers. Two, will you pay those trans speakers? Because like these youth need paid, and the youth need opportunities to be paid. And we should not be asking them for free labor. I'm kind of rambling right now, but I guess what I'm trying to say is that like, I'm connected to the Flint community in a way where anybody that's seen, like, I'm a, like, how do I put this? Like, if you're seen as the underdog, then I got your back, and I got your back way back as much as I can. And I will use all my intelligence and all my networks to have your back as much as I can. And that includes the youth, because Black youth, especially Black gay youth, are ostracized, especially in the city of Flint, especially in America, but especially in the city of Flint, and are kind of like pushed to the side, like they don't matter, and we don't have to provide them services, but we do, because these are like people, like we're people, and we deserve to thrive and not just survive. Yeah.
Thank you. Okay, this is our last directed question. What are the impacts of racism on adolescent health in the communities that you serve?
Good. So I'll go first. So first of all, let's define health, right? When we talk about the impact of, and really from my perspective, we have to define health broadly. Health is not just physical. Health is social. Health is economic. Health is emotional. Health is relational. Your relationship with yourself, your peers, your community, your sense of belonging, right? And so health is a multidimensional construct. And really, when I think of how does racism impact the health of my young people, I think in terms of the levels of racism, right? First of all, racism is internalized. And internalized racism is where young people might begin to take in negative messages about what it means to be who they are, about their negative abilities, about their intrinsic worth. And this is not just like low self-esteem. This is a structure of self-defeating attitudes, beliefs, and behaviors that support and collude with racism. And this internal dimension is really important, not only because of positive self-concept is critical, but because young people will live up or live down to our expectations of them and their expectations of themselves. If they don't see for themselves the possibilities of who they are, that's damaging. That is a health consequence. Now, racism is also personally enacted. This might be in the form of microaggressions or overt acts of hate. And in my work with young people, I've really created the space to, like, what are your experiences? And we hear it in our surveys with young people. They talk about how they experience being jumped, how they experiencing slurs, how just the negative experiences they've had, and that impacts health. But what's interesting, when I think the subject, what hurts one of us hurts all of us, really rings true, because when we heard from young people, we also heard from white youth talk about how difficult and hurtful it was for them to see the peers that they cared about being hurt, right? So, and there's also that level to which it impacts health. Racism impacts the life trajectories of our young people. Look at our schools. Our students still attend segregated, under-resourced schools where they have more police staff and school resource officers than they have nurses and social workers, in the school-to-prison pipeline, and their overrepresentation in the juvenile justice system and the child welfare system. I see this with the young people I work with. How do they exit outside of the child welfare system, which is a pipeline to youth homelessness, the street youth that I work with? These are all the result of there is the layer of there is the handiwork of structural racism in this area. But from a physical perspective, there have been pathways which have been described and theorized in the research as to how racism really affects health, right? We know that it affects psychological and physiological functioning. It has been shown to result in emotional distress, depression, anxiety, hopelessness. We know that because with structural racism, members of our groups might be at greater risk for exposure to risk factors and poor environmental conditions. Think of Flint, Michigan. Think of how COVID-19 has disproportionately impacted people of color because they are more likely to work in frontline jobs and can't afford to stay home, and staying home and working from home is not an option. That's a health impact. But more than that, we know about neurobiology and how racism is trauma and toxic stress, right? So when your neurobiology is always in this fight or flight mode and you're always on, we know how that affects your health. And we see this translate into rates of chronic disease, for example, in individuals that we know have experienced childhood adversity. So as we begin to sort of take tally and take inventory of the health effects of racism, I would invite us to really ask ourselves, how will we define health, and to view the many levels that racism operates and really corrodes us.
Yeah, to build on that, I think about the Flint water crisis and what it's done to the health of Black youth here in Flint, and what it's doing, like what unknown water crises are doing across the nation right now. Because as we know, while like the lead pipe issue was discovered in Flint, like lead pipes were laid all across America, or the states, and have not been dug up and replaced at all. And so, and then we know about in New Orleans when they had to relocate a whole housing project because the lead had gotten to the soil, and it was at really high levels. So they had to relocate a whole housing complex. And we know that a lot of youth live in those complexes, right? A lot of Black youth, Black and brown, and indigenous. And then we think about, just because I'm thinking of water right now, we're thinking about how they want to lay these pipelines, and how they're going against the treaties to get these pipelines laid, which in turn will poison the water, and just like it messes with our health, and especially these young bodies. But going back to mental health, in Flint, I think it's about 60% of youth right now are eligible for that, what is it called, an IE plan? It's the plan, the IEP plan. They are eligible and do not have it on file. And they're being not forced into, but they're being referred over to mental health. And these mental health professionals are diagnosing our youth with defiance disorders and disorders that kind of lead to, like, conduct disorders that lead to like being able to criminalize them once they reach adulthood. So instead of being diagnosed with ADHD and given IEP plans, or being diagnosed with a neurodivergent brain and given an IEP plan, they're kicked out of school, they're diagnosed with conduct disorders, and then later criminalized and or like just labeled bad. And so Black youth don't have that luxury of being kids. We talked about this the other day, and it was a lot of my coworkers, and it was just interesting, that have Black sons, and how I would say like 9 out of 10 of them that we talked to, all of their sons were recommended to stay back in kindergarten. And when they asked why should they stay back, they said, oh, we don't think they're mature enough to go to first grade. And when asked, like, well, what's the definition of maturity? Like, how are you rating their maturity? Like, oh, well, they're just busy. They just do a lot. And it's just like, so you're holding Black boys back for being kids. And it's just interesting how instead of looking at it in a way where we're looking at the impact of their health and their mental health, their physical health, we're looking at it as like this school to prison pipeline, right? Like get them through just to get them through. And we do this huge disservice by not calling it out, by allowing people that are white supremacists, because that's what most of these people are, they're white supremacists, to exist in these high positions to do this to our children. We allow the doctor that treats the pediatrician that treats Black kids differently than their white counterpart patients to stay. And then we give these excuses like, oh, well, you know, he's from a different time. And it's just like, well, now it's 2021. Like, is you gonna get with the time, or are we gonna continue to like criminalize our youth, our Black, brown, and indigenous youth, instead of like assisting them, like with helping them thrive in these systems, instead of using like shame and punishment to put them through these systems? Because like, do you look forward to going to the doctor when the doctor talks out his side of the neck to you? Do you look forward to going to school when every single thing you do, you're punished for? You don't look forward to accessing these systems. And then your parents had those same experiences when they were young. And so kids, listen, we hear, my dad was born in 1928. I know a lot of horror stories. I still have I still have these concerns that I live with, that I exist with, because of what he went through being a Black male that came up in like Jim Crow era, you know? And so like with that, like, how do we expect people to like thrive and to be healthy if this is what we're handing them? And everybody wants to talk about it, but no one wants to like be solution focused and say like, this is what I'm doing to combat that. They always want to like put together a diversity team and have some meetings. Like, everybody thinks you can fix it with a meeting. You need to fix it with action. I'm gonna like digress from this because I could go on and on and on about how racism just steals from us constantly, and how people live in this constant fight or flight, because like you can go to the doctor, and because you have this historical perspective, and you're in like this survival mode, like when you walk up to that counter and the front desk person ignores you, you automatically on edge. Like automatically, you just like, all right. And the mom's on edge and the kid's on edge, and the kid don't want to be there anyway. And then the doctor come in, and like, it's just like, we're not giving our kids, our Black kids, what they deserve at all, like at all. And we need to do better. I digress.
Thank you both so much. Thank you all tremendously for your insight and sharing your experiences and the intentional work that you're doing. We want to transition into the Q&A portion of the session. So I want to invite Saida and Jessica back to answer questions as well. So the first question that we have is, do you have recommendations for how white providers can ask adolescents about how racism affects them in a trauma-sensitive way? I struggle with how to ask about young people's experiences with racism in a way that is safe and not burdensome for them. For example, not feeling othered or like they need to educate me in an adolescent clinic visit. So you're all welcome to share.
Gotcha. I'll jump in. I'm very passionate about this, and I think I would love, I'm so excited to hear about how youth might respond to this and hear your suggestions. But before that, I want to say, Teresa, I want to be your friend, not just because I want to copy your bio introduction. So do you have recommendations for how white providers, can sort of begin to engage in this work? And this is actually something that scripting is very important, and setting the stage is very important. When you have established scripts, the language flows naturally. And so we describe this in this publication called Reaching Teens. First of all, I think wise providers have to first examine whiteness and view whiteness as socially significant, because oftentimes, right, there's unexamined whiteness. I'm just white. But they have to recognize whiteness as socially significant, and recognize that the approach to young people has to be trauma-informed, trauma-responsive, creating safe space. It has to acknowledge historical trauma, from slavery to Jim Crow laws to the present excessive use of force on Black and brown bodies, and recognize this as socially significant. But also, you have to be culturally curious and culturally humble, because you have to recognize that to young people, you don't know what dimensions of their identities they hold defining and how they self-identify. They might look brown to you, but maybe they don't identify that way. And so the way I open it in my clinic is, I always say, whenever I meet a young person, I'm always curious to get to know them and who they are. Tell me a little bit about you and what identities you feel are defining of yourself. How do you feel about being who you are? What are some of the messages that you've received about being who you are? What are some of the experiences that you have received about being who you are? Sometimes young people can take in negative messages about who they are and what that means. How has that affected you? How do you deal with this? Or how are you doing well overall? What are the good things about you? And so I think when you develop language and scripts, it will flow naturally.
Thank you for sharing that. And I think that my idea definitely develops from that as well. And I think that going in understanding that there is a hesitation there, that there is a lack of trust, especially because there is this history with Black people and working with doctors and working with people who seem in these places of power, and there's a distrust there. So I think that for the first thing you have to do, you have to recognize it and identify it and know that you cannot work around it, and you can't think that you're the exception to it just because you're a different person and maybe that's not your way of viewing life. No, you have to recognize that there is a power structure and you have to move in spite of that. So I think that the best way to do it, of course, what you're saying is just being personable. I think that there's always a level of professionalism to hold in a space like that, but also just being realistic. If someone is younger, they're probably going to be a little bit more likely to speak. And I think that that's a great way to get questions. So like, what do you like to do on the weekends? And just try to do well this, and like give examples of what a healthy lifestyle is looked on based on what they say to you. So I think that being yourself and bringing your full self, and then also accepting the full self of the person that you're seeing at that moment, is something that will really allow for a great work to happen. And both people are being serviced when you fully accept the identity of accept everything that's happened in the situation historically, and continue to view that person as a full person.
Okay, and we'll go to the next question. I would love to hear more from the panelists about tips for working within a slow to progress organization. I had to educate our HR rep on gender pronouns to improve practices and actually make tangible changes. We're assembling a DEI committee, but that's been in the works for literally months, and I'm deeply concerned that very little action will come out of it. Any guidance or tips are appreciated.
I don't want to speak if the youth want to speak. I just wait for y'all to, for like Jessica and Saida to unmute, and I'm just like, because like I'm really interested in y'all perspective too, because I feel like I can learn a lot from you all.
Hi, sorry, I was having a bit of connection issues, so I didn't get to hear the last bit of what Jessica was saying, but I think the first thing that comes to my mind is showing these people that how important it is to incorporate things like inclusion into our institutions. And I'm totally against like using BIPOC individuals like, or the queer community, or just any kind of minority groups experiences and like exploiting that. But I feel like when you really show these people who are unaware, these privileged people, or who have never really had the chance to interact with minorities, I think that it kind of makes them realize that like this is something important and it's something that we need to incorporate. So that's just like my first thought that comes to my head.
So if I might add, there's a document that I want to share with the group. And it's really about, first of all, institutional preparedness will vary. And there's this great document that creates, that really sort of categorizes institutions as to where they are on the race equity cycle. Are they on the wake stage, where they're beginning to understand and maybe try to focus on representation and presence? Are they at the woke stage, where they're trying to not only create representation, but you're not only invited to the table, but you participate? And then to the work stage, where they're really actively integrating this in all manners of operations. It helps to understand what are the levers of power, your board of directors, your customers, right? So it's really, once you understand like what are the levers of power that can be moved, it will help you move along. But if you're going to engage in this work, the one thing I will also encourage you to do is take care of yourself, because it's hard work, right? Audre Lorde says, taking care of yourself is not self-indulgence, it's a restorative necessity. If you go to work every day and you feel that this is a battle you have to fight in and out, you have to prepare yourself for the long haul and the long fight. So understand levers of power, but take care of yourself and build your support as you do it.
Yes, rest is radical. And we're taught to be busy 24/7. Like if you're not busy, you're lazy. I love to tell people when I'm laying down doing nothing, I'm very busy on a cellular level. Like, my body is doing all kind of processes right now. I gotta let it work. You know, and being that like I kind of take radical approaches to things, sometimes like there needs to be somebody that is willing to almost like throw themselves on the sword. And I understand that these are people's livelihoods that we're talking about. And I understand that this is your job and this is how you pay your rent and or your mortgage and your car note. Like I completely understand that. So if this isn't something that you can do, I am not suggesting that you do this, but I'm very much the person that be like, I thought y'all said that we was gonna do this. Why we ain't even had a meeting yet? We ain't gonna talk about it. Why is Todd still here? Do you know Todd used the N-word like 3 times? Why is Todd still here? You know, I'm very much like that. And I'm very much a person that will leave an organization that won't respect diversity and inclusion in a radical way. And when I say a radical way, I mean paying people what they're worth. I mean hiring people that look like the people you serve. I mean, like what Dr. Chulani said, like anti-racism as a verb. If I can't be in an organization that shows that that's what they are, then I can't be there. And that's me. I'm talking for me, because I'll be like, psh. And they be like, oh, Teresa, you work. I'm like, what? I don't work there no more. They be like, you ain't gonna put in your 2 weeks. I'm like, you ain't putting your 2 weeks when you call me the N-word. I got to go. And so I feel like sometimes you gotta like keep being that person that push that button and be the annoyance. And I know that there's spaces that I enter that people be like, oh my God, here she come. Like, I already know. And I'm okay with that. I'm okay with being that person, especially for my people. And my people, again, is anybody that's being discriminated against, that's like anybody. And so, like, sometimes we have to be that person. Sometimes you have to fall on your sword. And like, I mean, I'll fall on it. Like, put me in the game, coach.
Thank you. All right, I think we have time for one more question. And this one is directed to Jessica. As a pediatrician who is also African, it broke my heart to hear what you went through with your OB. Are there ways that you think we can work to improve care for our young Black women and men? What are the things that would make your doctor's appointments a more positive experience?
I think that a lot of this relates to my video uncertainty, just understanding that in order to adequately serve a patient, it's also recognizing who they are. You can't serve somebody in a small way. You have to fully accept who they are. You have to fully recognize their culture, their history, identities. And I would say that the easiest way to do it is just take a page from my former pediatrician. I was with her for my entire life, but there's always a report that goes in. It's always questions asked. It's always a smile, and everything is explained. And I think that especially when you're making that transition from I've only had a pediatric doctor, and there's a completely different level of tests when you go in as a woman versus when you went in as a child. And I think it's as simple as, taking something, it's like, this is what the test is for. This is how it's going to be done. This is when you get the results, and saying it in a way that's informal without being condescending, just so you feel like an active participant. Because a lot of times you do feel like, okay, so many things are happening around me. I want to feel included in the health decisions for my life. And being able to explain to something like what's going on, what it is in very layman's terms, is going to create a sense of trust and a sense of understanding. And the more that you understand and trust, the more likely you are to get the full benefit of that service. So I think it just comes with having a conversation, being clear, being direct, and speaking to someone like you would want to be spoken to at the end of the day.
Thank you, Jessica. Well, this has been amazing. Thank you all again for sharing your insight. We're now going to take a 10-minute break, and we will return at 3:18 p.m. Eastern Time for a session on care, not punishment.